Hi, good evening, everyone. It's 8 p.m. and welcome to the Expire Show. And well, you know me, so I don't need to go into details. This week, our guest is in Taiwan, so he's not back in Singapore, which is coming back soon. And therefore, we are not in the studio. In fact, we are now on the traditional Zoom. Okay. And so I would like to introduce Jacky. And Jacky is the CEO and founder of UpperMed, and he works on something that is I used to be working on, but different devices. So we can communicate very, very well because what he speaks on scientifically, clinically, I can understand. All right. So he's working on dialysis, but I will not steal his thunder, and I will let Jacky introduce himself and what he's working on, and then we'll go into Q&A and discussion. Okay, Jacky, go ahead.
Thank you, Prof. Neil. Hello, everyone. This is Jacky from UpperMed. Really appreciate to have this opportunity to share what we're working on with everyone in Zoom. So yeah, same as what Prof. Neil say, we are working on dialysis, and actually it's a domain Prof. Neil have ever taken for quite some time. So he's really an expert and key opinion leader of this industry, and I really learned quite a lot from him. So let me introduce myself. So I'm the founder and CEO of UpperMed, and previously I studied biomedical engineering, master of degree from in NUS. I come to Singapore in 2017. So it has been like 4 to 5 years already. After graduation, I went to A-Star to extend my, I would say, career. Yeah, and then in the meantime, this when I attend a NUS group. It's an accelerator hosted by NUS, and it's a fantastic. There's a fantastic workshop, and also hosted by Prof. Neil as well. That's how we met each other. Yeah, so I would say all the journey start from NUS, and it's still going on. Yeah, so back to 2020. I went to a NUS group and tried to figure out what kind of entrepreneur I would like to do. And before that, actually, I attend so many entrepreneur competition and kind of lost it because there's so many fancy events, right? So you just go on and you didn't sit down and think about what kind of business you like to do. You just pitch and pitch. You are not doing things. So I go to group and then I find out what they are really looking at. I mean, for those people who would invest, what kind of thing they would like to invest. So for those people who are interested in startup entrepreneur, I would really recommend to see what a NUS group is working on. Yeah, so that's how we start our business. And then we, after graduate from accelerator, we continue. And then we also enroll another program sponsored by Singapore Enterprise. It's called Jumpstart. So it's kind of another accelerator, especially for medical device, sponsored by Singapore government, and it's hosted by four university like NUS, NTU, SUTD, and SMU. Yeah, so it's also another good opportunity if you like to dig in. If you are a medical device company, to be specific. Yeah, so we also won Meta Innovator APEC last year. We are top 20. So this is a quick introduction of myself. And recently we are featured by NUS Group since we are the only two team won't participate in the cohort of Meta Innovator Asia Pacific. It's really an honor to be posted on the websites. Yeah, so when Prof. Neil invited me, he mentioned why I would like to pursue STEM, right? I mean, everyone know what is STEM is now because there are so many successful stories. Like for those entrepreneurs, most of them probably come from engineering background. So they could design, they could write app, write website, know how to code. Yeah, but for me, it's very simple, very straightforward. It's like I like customization. For example, if you go to IKEA and buy a chair, I don't want the chair from IKEA. I have to make myself. make a little bit difference, like not just for a normal simple chairs. I would like to be a fancy chairs, like with soft clothes and layers, and it's made me feel more comfortable if I like on the chair. Yeah, so I feel like STEM has some magic, like it gives you a power to create what you like to create. That's why when I was at university, I choose material science and engineering. I also study chemistry at the same time. Yeah, so now everyone knows STEM, so you don't need to be promoted. But I would like to share a little bit about what if you learn STEM, like kind of engineering course, right? What you can do in the future. So from my personal point of view, if you like to run a startup, right, most of the time you need your logic. Like you have to communicate with others. You have to share your idea with other people. And the core value of STEM is training your logic, like how you do things, how you communicate well, how you make your theoretical like paper become a real product. Yeah, so I would say that's really a fantastic lesson I learned from the STEM. Yeah, and that's really awesome. So very quick and brief mention, and I'd like to go into what we are working on. So we know COVID-19, right? Like everyone know COVID-19, we are under quarantine. Sometimes if you are diagnosis be positive. And what if you are a patient? For example, if you are a dialysis patient and you have to come back hospitals regularly, like 3 times per week, what if they got infected? So actually, quite a lot of data has shown dialysis patients have higher incidence rate and mortality rate than the normal people like us. So they are really dangerous if they keep doing dialysis at home. That's why recently, I would say for a long time, many countries are pushing home dialysis policy. So home dialysis is like you do dialysis at home. You don't need to come back hospitals frequently. So it sounds awesome, right? Then how you do dialysis at home? So peritoneal actually is an alternative way to do dialysis since 1920. It's the most popular method to do dialysis at home. So this dialysis can be easily completed by patient themselves. It means they could take care of themselves. And more importantly, there's no blood drawing. So you don't need to draw your blood and manipulate, control very complicated machine. No, there's different type of dialysis. That's why this type of dialysis could be conducted by patient at home themselves. And to do so, you have to accept a surgery to place a catheter on the belly. So it's like a laser catheter, a permanent catheter. Yeah. And then with this catheter, the fluid can enter a patient's abdomen via the connected tubing. So during the time the liquid is placed inside the body, the toxic component will keep diffusion into a solution. And to keep this efficacy, to keep removing toxic component, patient have to change this solution 4 times every day. So it's like a threshold, right? Like you have, if you like to stay at home, you have to take care of yourself. But it still sounds nice, especially in the COVID-19 situation. But there's some hurdles, I have to be honest. And that's why we focus on this industry. So first of all, if you stay at home, you don't come back hospital, then doctors don't know whether you do dialysis. They don't know whether you conduct the dialysis regularly. They don't know your condition. So it becomes a problem, right? That's why telemedicine is so popular in the past 2 to 3 years. And second problem specifically is because the infection, the dropout rate. So when patients conduct this kind of tubing connection, if they don't do the proper hygiene, you might get infected. If you are infected, you have to come to hospital as soon as possible. But now, patients rely on their visual judgment to identify infection. That's why some people might miss the golden opportunity. Like in the early stage, when they are not affected very seriously, they don't need to remove all the tubing because they are infected. And that's the moment we would like to see it. So what we are working on, we are working on a home dialysis management system. It includes a device and the data management service. So with our device, we could speed up the flow rate. The higher flow rates and automatic data recall can speed up the whole procedure, and we can help patients save a lot of time. And in the meantime, this data could be passed through the app and into a clinic, so medical staff could know whether patients conduct dialysis regularly. It's awesome, right? So remote patient monitoring is very critical, especially in the current COVID-19 situation. And more importantly, is the infection problem. So we have an exclusive optical system to help patients better identify infection at the early stage. So traditionally, patients have to rely on their eyes. Now you have a device, a system to help you conduct the dialysis with faster procedure and easily. You don't need to worry about the infection problem now. So I have a quick demo about how to use our device. Actually, it's quite simple. So this is an 60-year-old lady, and it only take us like 30 seconds to teach her how to use the device. It just simply press the tubing into the groove of the device and then close it. It's done. So basically, it's a non-invasive device. So it's very safe. There's no more infection, no additional infection concern. And then it's very light. It's only like 1 kilogram, easy for you to bring anywhere. And most importantly, it's compatible with existing consumable. It means if you rent this device from us, you could just use it. There's no other things you have to worry about. And actually, this kind of home dialysis, peritoneal dialysis is booming, especially in Southeast Asia, in Thailand. So since 2006, Thailand has pushed PD first policy. And the patient in Thailand who conduct the PD has grown so fast in the past like 10 years, right? It has grown around 400%, and it's still growing in almost like 7 to 8 CAGR, annual growth rate. So we really emphasize these markets, the whole Southeast Asia markets. And we definitely have some partnership with the software company, device company like Omron. They are very enthusiastic in digital health industry. And clinical trial, we partner with several hospitals, some from Taiwan, some from Singapore. And most importantly, it allows us to conduct the RB, the clinical study at the hospital with the help of these doctors. So we have some result, looks very promising. In this image, it's hard for us to identify which one is an infected case, right? But it's very easy for our device to quantify it. So that's why we are so confident. Like with our device, we could really help patients solve difficult problems and help them conduct dialysis at home in a safer environment. They don't need to worry about this problem. Definitely, this is a big market. Then there's a competitor. So across all competitor, we provide a portable size device, the most portable one, most lightweight one, and the exclusive optical system. And in addition, our non-invasive design can lower the adoption rate will be higher because it's so easy to learn how to use it. Yeah, and they will be different from the competitor, like the company I show on the list. Yeah, and definitely the big company like Baxter Fresenius Medical, they have very high market rates in the current situation, and we have some opportunity to partner with them. I will introduce it later. So definitely we want to make money, we want to earn money, right? And what's the business model? In our case, we like to conduct B2B. Like as I mentioned, we like to partner with dialysis provider. Like with our infection monitoring device, we could extend patients' whole duration, whole journey on home dialysis. And those dialysis provider, they could earn more money. So it's kind of like win-win situation, right? So with our device, we help patients have a better life. They don't need to change, like come back to hospital to conduct dialysis. They could stay at home. It's not so good. It's more like win-win-win. Like patient also have a better life quality. Yeah. So we would like to go for B2B partner with this kind of big company, as well as we could do a direct rental to patient. And in some market, especially like Hong Kong, they don't have a reimbursement to rent the device. So the current device is so expensive. It's too expensive to afford for those patients. In next case, our device has the advantage of pricing. So there will be our good opportunity as well. But long-term saying, we want our device to be covered by a reimbursement. So we use like United States CPT code, for example, to cover the remote patient monitoring service. And for now, we have a workable prototype. We are moving to first in human trial, and we also pass our IRB. And in the next step, and especially the most important milestone in this year, is our human trial, as well as the animal study. Yeah, and after that, we'll raise our first price round. Yeah, and hopefully to launch our products by 2023 and expand to other markets. So to introduce our team, we're a group of founders that have worked together for over actually it's 5 years now. When the team just started, it's like 3 years. Yeah. So I'm a software engineer, previously working at Star, and I'm in charge of the fundraising plan. And I also work on the app and the whole website. Yeah, and my partner, they mainly focus on device hardware development. They are expert of electronic, mechanical design, 3D printing, and prototyping. Yeah, we'll also have one architect to help us design the class structure, because we would like to do a remote patient monitoring, right? An advisor, most important part. We have several doctors from different hospitals, like Dr. Martin from NUH and Dr. Lin from National Taipei Medical University Hospital. Yeah, and definitely business advisor, Prof. Ignatius, my teacher when I was studying at NUS, and he's also really a good mentor. Yeah, he teach several entrepreneur class, and I really recommend, if you're a student of NUS, I really recommend you to give it a shot, and you will really learn a lot from the whole module. Yeah, and that's the end of my introduction. Thank you for your time.
Okay, thank you, Jacky. Let's make it very simple and very conversational.
Yep.
So I think we can have don't need the slides.
The slides.
Yes, the slides. We just have a conversation. So I think what I would like to discuss with you is on the whole process, right? How do you actually discover this opportunity?
Right. This is a very interesting story, because when I just start the program at GRIP, right? Actually, I bring another topic. So okay. The topic it's more like a student entrepreneur topic. We won several awards, and then we like to make it commercialized. It's about a urine output monitoring system. So we have some connection with the renal nephrology. Yeah, so when we keep talking to nephrologists, one of it, Dr. Martin actually suggests us to use the flow monitoring technology into another industry. So they bring us a new word. So previously we just focus on the urine, but he said, oh, you know how to walk on the floor, right? Why don't you just try like home dialysis? Because he believes this is the future. Yeah, so that's why we start on this topic. It's very interesting.
So I say, let me look at it from the business model point of view, right? So you have a business or a problem, you develop a business model, and then you go out and test the market, you interview, right? You do field validation, yeah. And then you discover that hey, actually the doctors are not very interested in this, right? Normal urine.
Yeah, you know, topic.
But the bigger issue is really the dialysis patient who need to monitor. They got no choice actually, but they don't have a good way to do monitoring, and that's where the problem comes in, right? Well, so you have field validated the problem. It's a hypothesis and to test it in the field. How many people you talk to?
So personal interview, we have conducted over 30 patients and 10 more doctors and nurses. I mean, so now definitely it's more. What I say is like 2 years ago. Yeah, so to validate this is a really solid questions. We interview the doctors across Singapore, Taiwan, and Hong Kong. Yeah,
Okay.
and that's why we are confident, because normally medical problem, right, is a universal problem. So that's why we do it in this way.
All right. So when you decided to work on this, right? You talk to 30 people. You have validated there's a need. How do you then determine what's the size of the market?
Yeah. So actually, at the beginning, everything is like blurred, right? So when we talk to more patients, we come up with a very precise unmet need, like what they really want. We have so many features on our device, like we could control flow, data management, but what really make them pay the money probably is like we improve their life quality. So we ask them how much they would like to pay. We have a questionnaire, and then we could use a button up, like we count how many patients in different countries and say how much money they would like to pay for it. So that's one way. The other way is we could search some data from the paper. But it's normally less persuasive, but it's also a good insight to provide. So we would do it this two way.
So what is the final computed number for your market?
Okay. So the whole around the world is like around 2 billion, the total market size. But the annual market size is around like 400 million. Yeah.
2 million patients, but the value is 400 million. Right?
Yep.
Okay. All right, good. So this is from a bottom-up kind of computation, right? Okay, so now, but you have to develop something because you pivoted, right? So you have to develop something to test the market, right? How do you check whether your minimal viable product or MVP is correct? How do you define the actual features?
Yeah, that's also interesting because when we interview several people, right, they always give us different feedback. So it's very hard if you only interview like 3 or 5 people. You have to interview more, like 10, 15, 20, and you realize some of the question would repeat again and again. That's how you know those topics are more importantly. But later on, we design a questionnaire. It means we spend like 3 to 6 to consolidate the picture of our product, have a rough idea and release it out, and then we do a final questionnaire to say, hey, do you really need this, and how many % of the patient really need this function? So at the end, we have another questionnaire to prove what kind the function we provide is really needed by patients. That's how we do the interview. I mean, yeah, the proof.
All right. So okay, good. So now you have used the program to discover opportunity, identify the MVP, but then you need money, right? So
yes.
How do you raise the fund then?
Yeah, I have to say, group is definitely a good choice. Like US group would invest in the team 100,000 Singapore dollars. So after the investment panel has approved. Yeah, so that's one way. I mean, at the very beginning, early stage, if you don't have a very solid, like you don't have clinical evidence, right? You need a prototype, then you need money to make the prototype workable. So you will have the clinical evidence. Yeah, but prior to that, it's very difficult to take the money from the investor, especially for institutional investor. So like the program like NUS and Jumpstart, right? This is accelerator program. It's really helpful. So I would say the first investment could come from them. And after you are selected, right, you could use them to raise from your friends and from other institutional investment. So in our case, we're introduced to Brink. There's another Hong Kong accelerator. So also helped by NUS a lot. So I would say find a good accelerator, very resource one would be a very nice step.
So maybe there's a question from the audience, right? You say, basically, thank you for a talk. They want to ask about tips for pitching an idea to real life investor. And what is it like for you and your team to ask for investment? What's the feeling, right? How many times you pitch and how when people say no, how do you feel? How do you manage?
Yeah, actually, in my like first 10 or 15 pages, I'm always exhausted. Like I try to answer every question an investor or audience would ask. But at the end, I feel like I could use the slides, the content of the slide, to control what kind of problem they might ask. So that's one step you could try. And how I feel actually is like I learned a lesson. Not every investor really care about you. So sometimes some very harsh problems, you really couldn't answer it, right? But you need the ability to identify which kind of problem is just like for asking. They just want to ask something ridiculous sometimes. Yeah, but some problems, some people, they are really asking a real question. Like those kind of mock question, they need to know to reduce the risk. So from my point of view, as a teacher, you have to provide enough evidence, like those letter of intent, those interview you have conducted with the doctors or patients. That's the weapon you could use in your picture, and that's the most powerful one. Instead of you tell a very beautiful story, but that's just a story.
Yeah, so that's why when you are doing your validation of your opportunities, when you interview people, you collect those survey numbers, quotations, and that is when you do pitching, you can actually use some of this, and you can quote this guy, right? This doctor from this hospital, and then people will believe you, right? Rather than you just keep on talking about it. Okay, that's a very good tip for investment. Then I think some people will be very interested. Actually, when you are new, right, and you want to pitch for investment, right, and you're not too sure about the value of a company, how do you actually decide what's the percentage to give away? What do you have any techniques?
Yeah, actually, there's another problem I'm asked very often, and there's no correct answer. So when you read the books, right, definitely we use a Silicon Valley, like the valuation of the stock in Silicon Valley, and you will realize the investor in Singapore or in Taiwan, they don't buy it, like they don't think you value so much. So valuation actually depends on the market where you are at. So I would say it really depends on what kind of investor you met. So if there's an institutional investor like on your script or Brink we encounter, they have their system. Like when they enroll a team, they invest the certain number with a certain share. So you could decide whether you like to take it. So that's the easiest way. Find someone to define your value. Yeah, and if you like to find an angel investor, normally this is what people start from, right? There will be a tough one. Like normally the professional investor don't care about it, right? Because normally you have friends, you have families, and the valuation they give you is a nonsense. So I would say very important steps as a startup, you have to find institutional investor to define the valuation of your company. And you could offer yours, they could deny it, they could negotiate with it, but only if you all agree with the valuation. That's where does it come from.
Okay, so obviously there is when you first start off, right, it's very difficult to determine the valuation, but a couple of techniques. One is, of course, the simplest way is how much you invest your time and the money in bringing the project to that. That means X. I invest X to bring this project to this sum, and then I just 3X, which is not scientific, right? Because it can be you can be invest a lot of things, but you work on not good stuff. Is actually investment down the road. It's not a serious thing, but at least there's a guide. Another technique, is that if one way is to say, if I'm going to develop the same thing again, how much money I need right now, and I think that is one way of doing the valuation. More realistic. But I think a lot of angels will probably look at, say, they use a SAFE, right? That means it's a loan to you, convert to shares later in terms of percentage, but they're not sure where's the valuation. So they will say, the next guys who comes in, what's the valuation? I take a discount, right? I take a 20%, maybe 50%, depends on what's the risk appetite. And that's what we call SAFE, right? SAFE stand for what?
Simple agreement for future equity.
Yeah, I don't understand what you mean by simple agreement. There's actually no agreement. Simple agreement for
Yeah,
future agreement.
relatively.
So that's safe. Yeah. So that's the technique. Now, now you are unique, right? You come from Taiwan, you come in Singapore, and now you are going back to Taiwan to do your clinical trials, maybe start your first market. So how do you manage these two countries kind of business? Normally, a startup will stay in one company, right? When they are really,
Yeah.
really, yeah.
Yeah, it's really tough actually. Also there are visa problem in COVID, during COVID-19. Yeah, so for us, at the very beginning when we do the market validation, most of the time we stay in Singapore. Yeah, but now because we are moving to a mass production and we realize in terms of the like product manufacturing like factory, right? In a current condition, there's a shortage. So you have to find how to say, you have to find someone you could trust so that your data, your timeline could satisfy with what you expect. So that's the reason why we come back to Taiwan, because we have more resources instead of in terms of manufacturing, and we can control our timeline. Yeah. So in the past year, most of the time I stay in Taiwan, and we seize this opportunity to talk to many hospitals as well. And in the past year, I think this very different and very, very tough for us as well, because there's an outbreak in Taiwan as well. Yeah, so we couldn't visit hospital for 3 to 4 months, like what we met in 2020 in Singapore. Yeah, so yeah, it's tough, but because we need it, we need a manufacturing resource in Taiwan. That's why we spend more time now. Yeah, but at the end, when we have to move to the marketing like stage, then I will come back. I will come back Singapore. I think the time is coming. Yeah.
So the one thing of the about entrepreneurship is that you as you say, is that the time is tough, right? And you need to last and go through the tough time. And you have a team, right? It's not just 2-3%. So some people will feel that, oh, why am I doing this? Should I leave and get a job? All right. And because now, how do you manage all these things?
Yeah, I couldn't say I really manage it because it happens. Yeah, so at the beginning, we have a big team, like 5 or 6 people. As the time passed, some people left. And until we really start our business, have a company, there are only 3 people in our team. But I think we're lucky. We are very clear about what we would like to do. We set a clear timeline and the milestone we have to achieve it in a given every year, right? For example, like this year, our most important milestone is a human trial. Yeah, so the key is like you always talk with your partner, like you spend most of the time with them. Although we know Zoom is very convenient, right, to have you connect with the people online and you don't need to leave the house. But I would say it's still different when you really spend the time with your partners, with a team, face to face. You could easily talk to them. So it's not just business. You need some mentally connection with them as well. That's how you could face any kind of challenge. Yeah.
Okay, there's a question in the audience, and they say that thanks for the talk. They are curious, are there any harmful effects of the device or possible risks?
Yep, that's a good question, because medical device definitely need to be reviewed in the most rigorous way. So in our case, we would like to get rid of this kind of concern. That's why we use in a non-invasive way, means we just install on the tubing and the device won't contact with the fluid inside tubing directly. And in addition, this tubing is one-time use, it's a consumable. So we could reduce the harm, I would say reduce the risk of the harm, not exactly harm, to the minimum. Yeah, that's how we work on this.
All right. So now that you have identified opportunity, do your test, field validation, and get a, you are now doing your clinical trial, right?
Yeah.
Yeah. And so for the next 2 years, what are you planning to do? What's what are the challenges also?
Yeah, definitely how to penetrate in the market would be the most important thing, and actually the challenge just in front of us, because this device at the very beginning, it may not be really recognized by patient, right? You have to educate patient to tell them, oh, we have this device and it's really helpful. So at the first year, when our device is on the market, I would say spending quite a lot of resource in marketing, like talk to the doctor, hold several seminar, and try to tell them what kind of our service could help in terms of the research for doctors, or in terms of the like remote patient management for patient. It could ease their pains and improve the life quality. Yeah, so that's something we would do in the first 2 years. Yeah, and definitely build out ISO certified factory is another very important milestone for us. Yeah, so we know how to do a prototype, and now we try to make our prototype become like move into next phase, that mass production. Yeah, there's something we have to learn. Yeah, quite a lot of things. But luckily, we have a good partner. We find a good OEM company to guide us. Yeah, so I really look forward to that.
Okay, so so going forward, you still have to raise more fund.
Yeah, less necessary.
So how do you define the job of the CEO now?
Yeah, actually I ask this question to myself every day. Like sometimes I feel like I spend so many times to reply the emails, contact with the vendor, try to get the quotation from them and compare with, oh, right, so many troublesome. Yeah, so it's very difficult to define the job of CEO in terms of what they do. But I would say what he want to achieve, or what she want to achieve, sorry. Yeah, the goal for the CEO is to maintain the daily work of the company. Get rest of funding is one of them, but you have to help your team to find the right resource. If you need a clinical evidence, you need the clinical study, right? You have to find a doctor, find a hospital, and partner with them. So I would say most important for CEO, set up our goal, try to make your team move as smoothly as possible. Rest of funding is one of it, although it's very time consuming, and sometimes you feel so frustrated when you speak to many people after that. Yeah, so I always tell myself what is my goal, and after I confirm it and feel confident with what I would like to achieve, then it's fine. Yeah.
Yeah, one of the things is that you see a lot in a lot of entrepreneurs is that the entrepreneur team is that they have these like advisors, consultants, and frankly, firstly, how do you choose? And secondly, first you choose the right one. Some people might just come in and probably not useful, and you pay them. How do you pay them? Money you pay them. Yeah. So how do you choose? And how do you sort of structure compensation for them?
Yeah, so there are many advisors who would actually ask for the share, although they don't invest it. And there will be something you have to be very careful. Yeah, I mean, they are very experienced people, but as a startup, most of the time you might not be so confident whether the way the roadmap of your product is correct. So you need the people to guide you. So a mentor or advisor is important. They are very critical. But for those people who might ask the share to you at a very early stage, that would be very confusing. Yeah, because no one knows whether we are at the right track, right? And we really need the mentorship from the advisor to do so. So I would say you have to talk to many people. You also do the DD to the advisor. Yeah, I mean, this advisor mostly would be business advisor, not just a medical advisor, because medical advisor, what they do is very obvious. They could help you apply the IRB, or they could help you conduct some clinical study. So the value is very clear. Normally, you won't have other issue on this. Yeah, so I would say business advisor is something starting will have more concern needs. Definitely try to write down the milestone you want your advisor to achieve. And if you use a milestone to return the profit to him, they'll be more, I would say, reasonable. Yeah.
Okay, so any advice, 3 advice that for people who want to go into entrepreneurship or want to come up with new innovation?
So first, find a good team. Second, find a good timing. I would expand first and two together. So I really feel like I'm lucky people to meet a good team and in a good timing. So let's assume we are like 10 years older, then I might not have enough, I might not brave enough to spend all my time and sometimes all my money in my startup. Yeah, so how do you know it's a good team? I mean, when you are confident to work with these people for like 2 or 3 years, for the following 2 or 3 years, and you are willing not to take any money from the company, then I would say if the topic you pick, the problem you are going to solve, bring you so much confidence, then I would say you find a good team as well as you find a good topic, right? You have to persuade yourself. And most of the time, those founders, right, they have other opportunities. They could earn the money much more than being an CEO most of the time. Yeah, and while you take a risk, definitely you persuade yourself. Yeah, so that's first and two. And the third one, I would say, there's no repeatable successful story. So for those people, for those successful startup who has been MMA or being IPO, most of the time their story cannot make you become like you know their story, but you couldn't repeat it, right? Most of the time, but you could learn how they prevent some failure. Yeah, so that's how I help my friends as well. Like I always talk to them, I could share my story with you, but I think more valuable is what kind of like failure I've ever faced and how I encounter it, or at least at least you accept it sometimes. Not encounter but accept it. Yeah, so those experience would be more valuable than the story of a company. Yeah, that's what I want to share.
Okay, that's good. So we are now into 43, about 40 minutes of discussion. I think that's good enough for our audience to understand your journey, your experience, and also pick up tips on how to do pitching and investment. And I'll end with your no repeatable same story. You have to experience the journey yourself, right? So thank you very much, Jacky, and have a good stay in Taiwan, right? And stay safe, and probably we'll catch up with you when you come back to Singapore very soon.
Yeah, okay. Thank you, Prof. Neil. Yeah, thank you, everyone.
Thanks everybody for online, and we will see you in the next show again. Bye.
Bye.